Hello everyone. This is Dr. Smita Takote on Mission Duty Sundarmi Bonaras. And I'm very sure you women are waiting for the interview series. And today we have got a gem of a person by name Dr. Trupti Khatawkar, who comes from the beautiful city Sholapur. And let me tell you, she is one of the wonderful practitioner in Sholapur since last 19 years. And her education of schooling was done in Latur. And she did her M.B.B.S and her post-graduation from Mumbai. So her M.B.B.S, she worked in KEM, and her post-graduation she did in Lokmanya Tilak in Mumbai. And to add the feathers, she loves wildlife. No wonder she is a happy-go-lucky mother of a wonderful son who is in 10th standard. And definitely she is partnering Dr. Prasanna, who is a psychiatrist who's really taking care of psychology and dermatology. So here all the beautiful women, I'm presenting to you Dr. Trupti Khatawkar on this platform of Mission Beauty Sundarmi Khodarats. So welcome Dr. Trupti on this platform.
Thank you. Thanks a lot, madam. And thanks for the wonderful introduction. Thanks a lot. Okay.
Menopause is such a setback to women that women often see lot of changes in their face, in their eyes, and not to forget the crowning glory. So that is the hair loss. So today's topic is very interesting. Women, do you have hair loss? Then don't miss this interview till the end, because you're going to have fabulous tips coming from Dr. Trupti. Yes, Dr. Trupti, what is hair loss which happens during menopause? Can you highlight?
Yeah. There are various causes and various types of alopecia or hair loss. Today we are basically talking about female pattern hair loss. So female pattern hair loss can start from a young age also, like start from 30 to 35 age also, but it's more prominent after menopause. In this hair loss, basically the females lose their hair from the middle of the head, and as they age, that is the crown, and or we call it vertex from this area. And interestingly, the hair from above the ears and the back side of the scalp are pretty well maintained. So what usually the ladies come to us, the complaint is that their partition, or which is called mang in Hindi, the partition is getting wider. That is their main complaint. And as the partition becomes wider and wider, they are afraid that they will go bald. So this is in short the female pattern hair loss, or a hair loss which is quite prominent at the menopause. Yeah.
Why does this happen, Trupti? I mean, what is that hormonal locha happening, creating all this?
Yeah. So there is a hormonal locha and chemical locha responsible for so many problems of skin, of hair, and entire body. So what happens in female pattern hair loss? When we say female pattern hair loss, similar thing happens in males also, which is called male pattern hair loss. The reason is almost the same. What happens is that we have a hormone in our body which is testosterone. You must have heard about this hormone. Some males, some gents become bald as they age. So we know that there is a recession of the hairline goes back, there is loss of hair from this area, and if a person doesn't get a treatment for this, the baldness increases and a person can become totally bald. Similar thing, of similar cause, when it happens in a female or a lady, what happens? Fortunately, we don't go bald. So fortunately enough for us, we maintain the frontal hairline. This is the frontal hairline. So the hairline is maintained. We may have some recession from the frontal area. That is, we may have some hair loss from this area, and we have sparse hair over here. So what is happening is, we know that males are having this hormone testosterone, but females are also having this hormone in our body. Normal females also have this hormone in our body. As we age, the levels of the hormones change. Our estrogen levels go down. So what happens? There are receptors in our hair roots, and they are responsive to the testosterone or hormones. And some people are genetically prone for this female pattern hair loss. So if your mother is having thin hair, especially over the vertex, that is this middle part of the scalp, or if your maternal aunt, if your paternal aunt, your grandmother are having such type of thinning of the hair from this area, you are genetically predisposed to develop that pattern of hair loss. If your father is having baldness, if your if your maternal uncle, paternal aunt, or brother, cousins, they are having baldness, you are genetically predisposed to have female pattern hair loss. So what happens in female pattern hair loss? What we usually see is, first thing, when we part the hair, it becomes little wider and this area goes little behind. So these are the things which we can see. There are some other changes which are happening at the root of the hair, which we will talk about it later. But these are the changes which we can easily see. If we don't treat it, then the hair become quite sparse, and you can see the scalp from in between areas. That's the time when the ladies come to us. That's the time when a friend or a family member tells that you are becoming bald. So that's the time they come to us. So these are the clinical signs. Yeah.
Do women come to you saying, Dr. Trupti, what if I lose all my hair? What am I supposed to do? How can I live without hair? Do they come in that panic situation?
This is the common complaint, and this is the common I think worry of all these females when they see that they're losing a lot of hair, and their hair they are becoming very sparse. Their nightmare is that they will become complete bald. But fortunately, that does not happen with any of us. So just don't worry about it. This problem is treatable. It's easily treatable to some extent, but it is definitely manageable.
So nobody is going to go totally bald. You women out there, please read this message very strongly that none of y'all are ever going to go bald like your husband or like your father. Yes, that is really important tip.
Yeah, there are a few advantages of being a female. We can say this is one of them. Yeah.
Wonderful.
For sure.
You should be proud that we are the women category, you know.
Yeah. Yes. Yes.
My next question is, quite a few women, you know, when they reach menopause, they say, now I don't think it is really necessary for me that I should look good. But it's a need of the hour. Do you think, Dr. Trupti?
Yeah, definitely. I think this is the need of the hour. Today, no one is sitting at home. Okay, all the ladies, we step out of home, whether we are working or non-working. This is a wrong term actually, working or not working. Everyone is working. But even if like we are doing the job or we are working at home, we step out. And in this the era of this social media, like even if we don't step out, we are seen. Okay, so we have to be presentable. So I think a cosmetic problem which is easily manageable without almost any of the side effects, why not take advantage of the science which is for our health? So I think it should definitely be treated. No doubt.
So basically, women, no sooner she starts noticing the hair loss, which is out of proportion, I think she should definitely visit a qualified dermatologist for the best possible treatment, because normally what happens, people once they start seeing their scalp, they visit. So it's quite
Yes.
late.
Yes.
So one simple advice to all the women out there, no sooner you feel that the hair loss is really getting more, just go to any qualified dermatologist, check their degree, and please reach them, because they will be really helpful to really prevent that baldness that is happening. And don't open your eyes once you go bald. So come much
Yeah.
earlier to
Yeah.
give.
I totally, yeah, I totally agree with you. When you see your scalp, it is probably little late. When you start seeing a lot of hair like falling from your scalp, you should take treatment. You should see a proper qualified dermatologist. You should not be your own dermatologist by reading the YouTube posts. Many times what we see, all of us see that patients lose the important like years of the treatment period just by doing some applying some non-specific remedies, some onion juice or something. And there are so many things. If you go to YouTube, there are so many things which will not help in this particular type of hair fall. See, hair fall is not one particular thing. It is like one umbrella term. It's like saying a patient has got fever. If we say a patient has got fever or someone is having headache, we are not telling the diagnosis, we are not telling the cause. We have to find out the cause, then only the treatment can be given. Similarly, hair fall is a symptom. There can be so many various diseases, so many various problems. So your dermatologist can find the cause, whether it is a female pattern hair loss or it is a hair loss after some disease like COVID or dengue, or it's a hair fall due to anemia, that is low hemoglobin, or it is a deficiency of protein or a deficiency of micronutrients or stress, or there are so many other things, or is it a side effects of some medicines that you're taking from for some problem. So your dermatologist can find cause of the problem. What happens in female pattern baldness? We have to look, like we have to check the hair. What happens in this hair fall is the hair in our scalp, hair in on our scalp, they are in three different stages. The maximum number of hair are in anagen phase, that is, they are growing. A little percentage of not growing, and yet another small percentage of hair are falling. That means the root of the hair is dead, and that particular hair will definitely fall within 2 to 3 months. So when we check the scalp, what we see in female pattern baldness is that the growing hair become less and the falling hair become more. If you see, if you hold one strand of hair, one single hair, what you will see is that the hair here is thinner than the hair here. Even the patient herself can also check it. So these are some changes. There are many methods by which we diagnose the case as female pattern hair loss, and accordingly we plan the treatment. So just don't blindly follow some XYZ non-qualified doctor, or I don't know, a therapist, or just YouTube person who is not qualified, who doesn't understand the difference between the various causes of hair loss. Go to your qualified dermatologist, then you will definitely get the results.
Very true, and so beautifully told. No wonder I began with this Mission Beauty Sundarmi Honarats, and I decided as a dermatologist, I'm going to conduct a series of interviews of the dermatologists so that we could spread this scientific knowledge. And that's why I'm on this Mission Beauty Sundarmi Honarats. In the next 3 years, I would like to make 1 lakh women beautiful through this social media by giving the right knowledge, and the right people will be on the platform. So anybody, all these women out there, if you have hair loss, don't forget to contact Dr. Trupti Khatawkar, because we are going to share her contact number, and definitely she's going to answer all your queries, and she'll be there to handle your hair loss and tell you the right reason why you have the hair loss and you will regain back your hair. Stay confident because you are in the right hands. Yes. Wonderful. What is the role of massage, which is, very common? What is the role of massage?
Okay, what do we do in massage? Basically, we take some lubricant medium, oil, basically oil, and apply a little pressure in a specific direction. So, what does it do? Basically, it one thing, it calms your nerves. That is also quite important. Another thing is that it improves the circulation. Whatever nutrients, whatever vitamins the patient is like having through the meals or the supplements and all, it should reach the hair root. So by increasing the blood circulation, definitely there is going to be a definite uh, help in reducing hair fall. That is definitely there. Whatever oil you use, the oil may have some therapeutic properties, but massage definitely helps to some extent in reducing the hair. Yeah, that is for sure. To some extent, it is not the medicine, but it is an adjuvant. It will help the treatment. That
It is like
I
just
can say that.
taking care of your scalp and your hair follicles. That's how you
Yes,
could, just
yes,
put
yes,
that.
yes.
Yes, it's like a regular care regimen, just the way we wash
Yeah,
our face.
it is.
A
Yeah, it's
good
the.
hair
It
massage
is.
definitely is going to help
Yeah,
your scalp to be in a relaxed position, help to improve the vascular channels, help to, keep
yes,
your hair in a good condition because oil can itself act as a conditioner. So it will keep your hair soft. So your
yeah,
hair will look shiny, your hair will look
yes,
healthy. So definitely there
yes.
are its advantages. So we can definitely do a good hair massage. That is a must. My next
Yes.
question, many people talk about these, laser cap. What exactly are these kind of treatment? What is the advantage of these things?
Laser cap is a laser device which is made in the shape of a cap and which gives out a specific laser rays which will help the scalp improve the blood circulation. That is one thing. If the blood circulation is improved, you can have benefits of whatever you're eating and whatever nutrients you have. So it will basically relax the vascular channels and improve the blood circulation. That is the function of these laser caps.
So
Yes.
many times when women come to us, they are in the very late stage, then we
Yes.
definitely have to do some special treatments, some
Yes.
advanced cosmetic dermatological treatments, like
Yes.
what is called as derma roller, mesotherapy, PRP therapy. So can you just tell me something today, right now, as what
Yes.
exactly is derma roller and what are the advantages?
Giving the patient the treatment of derma roller or PRP or all these treatments, basically we have to rule out the nutritional deficiencies. Give the patient some nutrients which will help in the hair problem. Along with, see, derma roller is not a monotherapy. I mean, only doing the derma roller treatment or mesotherapy is not going to solve your problem. So you have to use some medicines also, one of which is minoxidil. You must have heard of, like all of us have heard of minoxidil. It is for females, it is used in the concentration of 2% and 5%. So your dermatologist will tell you which one is the best for you, which preparation is best for you. Should it be alcohol free? Should it be fragrance free and all? That is very important for female pattern hair loss. Along with that, the people who are not responding as expected, we can use instrument which is called derma roller. So derma roller is one steel instrument which is like a pen, and to this steel rod are attached many small needles. The size of needle can be 1 millimeter, 1.5 millimeter, and so. So the derma roller is rolled on your scalp, and along with that, we use some serums which contain stem cells for hair growth. So you need not go in so much theoretical details actually for the like general population. It basically the idea is, what is meso? See, derma roller is one instrument. By with the derma roller, we are doing mesotherapy. So meso and therapy. Therapy is treatment. We all know. What is meso? Meso is middle. Okay, so there are basically three layers of the skin everywhere on our body, including the scalp. So there is one upper layer which is epidermis, middle layer, and the lower layer which is the subcutaneous fat. So the root of hair is in the middle layer. So what we want is all the nutrients, whatever medicines should penetrate up to that level. So with the derma roller, we are making all these nutrients reach the middle layer. That's why mesotherapy. It is as simple as that. So whatever medicines or nutrients that we need, we take in serum form so that it can penetrate the deeper layer, and we do this with the help of a derma roller. So this treatment, how is it done? Before that, the person has to wash his or her hair so that there is no grease, no oil, any medicines applied, any cosmetics applied, dirt and all. It should be dry, and then we do the treatment. It's done every from 7 days interval to 15 days interval, depending on the severity of the problem, depending on the patient's feasibility and all. Usually 6 to 10 sessions are done. It's a good treatment. It is a good adjuvant to the minoxidil treatment. Another method of treatment which madam just told is PRP. PRP is platelet rich plasma. So what is done in this treatment is blood is taken out from the patient. It is separated. When it is separated, all the different cells, it is centrifuged. Centrifuge means um, it is given a good spin with a very good speed for a particular period of time. Let's say 6 minutes or so. And what happens is that the platelets, every one of us know what is platelet. Okay, in viral infection the platelet go down, in dengue they go down, some people have to be given platelets. So platelets is not new to all of us. So these platelets settle down at the bottom of the test tube. We take the platelets. These platelets have got various growth factors. They are platelet derived growth factors and so many things. Basically, these platelets have the growth factors will help us to grow our hair. Okay, it will nourish the hair root, and the hair can grow. So that whatever platelet rich plasma which is settled down is taken in a syringe, and it is with the help of a small syringe, insulin syringe, okay, or with the help of derma roller, the plasma is it's allowed to go up to the middle layer, that is the second layer of the skin. And the theory is that it will help the hair roots to grow. So this treatment roughly takes for one session, it will take around half an hour to 1 hour, and it is done every 15 days. Again, 6 to 7 or 10 sittings are done. This treatment is again not a monotherapy. That means it will not work alone. Along with that, we have to give some nutrients, some supplements, minoxidil, hair care routine, all of these things. So if you want to maintain your hair, if you want your hair to be in good shape, you should have some patience, because it's not a one session treatment. Usually this treatment will go on for 3 to 4 months, and after that you have to maintain whatever hair growth you have achieved with the help of your dermatologist. So that is very important. It's not a magic thing. It's not like operation. You have some skin tag, we have removed it, and the topic is over. It's not like that. We have to maintain the results. So you have to be little patient. Yeah.
Many times I tell my patients, you buy a car, isn't it? And you go for servicing.
Yes.
In the same way, when you want to look beautiful, you should go to a public dermatologist and get your servicing for your skin, for your
exactly. Yeah, yeah.
you want to really maintain yourself looking good.
Yeah.
And I don't think there is anything wrong. If you're doing for your car, Your body is
Yeah.
much more precious. Why not?
Yeah.
Your
Why
looks
not?
are more
Yeah.
precious. Why not?
Yeah. Yeah. Very, very aptly said. Yeah. Everything needs servicing, and
When it
skincare
comes
and
to
hair care is no
relationship, until
exception.
you pamper and you tell your spouse that you love him or love her, the relation is not going to bloom. You have
Yes.
told him during marriage, but what about now? After 50 years of marriage, after 20 years of marriage, you need to do that, isn't it?
Yeah.
That's
Yeah. The servicing is needed.
married.
Yeah. It's a continuous process. Yeah.
So everything needs food, air, water, love, pampering. So you have to do it. And who can be
Very
the
true.
best person who can pamper to make you look beautiful is a person who has taken more than 10 years to study the subject. Yes,
Yeah.
they know
Yes. Yes. Yes.
out
Definitely.
about it. And not only 10 years, they keep on getting updated for themselves. So,
Yes.
every 6 months, they come up with new latest treatments.
Yeah.
So, are you still going to apply yourself the oldest possible treatment, which is not tested, or you would go to a best qualified person because it's your body, isn't it? Do you want to harm your body? Definitely no. So, please
Definitely.
check yourself. Yes. My next question to you is, there are many women who have lost so much amount of hair and it's very difficult for them. And not only that, they've crossed the age of maybe 65, they've undergone some bypass, they have many medical issues. So is
Yes.
there a role of micro tattooing in this particular women?
Yeah. Yeah. Micro tattooing is a treatment for a specific group of people, people who have got significant sparseness of hair, which needs to be covered by something. Okay, and that can be a single step treatment, which is micro tattooing. So all of us know what is a tattoo. Okay, so there is a specific colored ink which goes in the deeper layer of our skin, and there it remains for many many years or indefinitely. So that same particular tattooing treatment can be done for sparse hair. So if a patient, especially females who are not totally bald, who cannot wear wigs, they are not bald. So small tattooing can be done. So the size of a single tattoo is very small, 1 to 2 millimeter size tattooing can be done. The color of the ink can be matched to the color of hair of that person. And if that person is seen from a social distance, that is 2-3 feet, you cannot recognize that there is micro tattooing. If you Yeah, of course, if you go near that person and take a lens, that you may be able to find it out, but it's not a day-to-day scenario. We don't see any person from that small distance. So micro tattooing is a good treatment, is a one-time treatment for people who cannot do this servicing. So who cannot go to the dermatologist every 15 days, get the treatment, take so many tablets, do some procedures, but still want to hide the sparse hair. So microneedling is a good treatment. It should be done from a qualified person, qualified dermatologist only, because if it is not done in that way, you can get some infections, some allergies, and so many other things from that tattooing, the needling of the tattooing. We see so many cases of allergic contact dermatitis and infections of tattooing done on hands and other parts of the body. Similarly, a person can have similar side effects by tattooing in the scalp also. So whatever treatment you have to you are willing to do, you should take that treatment only from a qualified dermatologist and one experienced dermatologist. People who have really become quite bald, some hair extensions and wigs and hair supplements can also be provided. If, the people who are very old and they cannot take treatment, this method can also be used for such people to mask the bald areas. So even that can be done in a particular set of patients.
Wonderful. Our women have so many questions of theirs have been answered, Dr. Trupti, because of you today. These were all the questions which was be pondering in their mind, and they wonder whom to go. Now definitely they can just, whenever they have this free time, they can just watch this interview on a Facebook or on a YouTube or any social media, and they have the right knowledge. I just want one take home back message that you would like to give to the women.
Yes, sure. See, the skin and hair, they are mirror of our health. So it's not just a cosmetic problem. If you see any problem with your hair, that can be a sign of some other medical issue also. So don't ignore it and go to a qualified dermatologist in time. Don't make it late so that you cannot have a proper treatment and cannot have proper cover of your hair. So if you take treatment at right time, you can have the best results. So that is my message for all the beautiful ladies. Yeah.
Wonderful. It was such a wonderful series. I would definitely not like to stop it, but this is just a beginning. We'll be coming up with a live session where people are going to ask you lots many questions, Dr. Trupti, and then
Sure.
be ready, because we would definitely come up in next few months live
Yeah.
sessions, and people are going to just flower you with questions which you need to answer.
Yeah, I will try my best.
Again to
Yeah.
you is, can you just speak a few words of Mission Beauty or Dr. Smita Sakhote as a ending remark?
Yeah, sure. Mission Beauty is not for a few people. It is not for celebrities, not for rich people, not for a particular kind of people. It's for everyone. Everyone wishes to be beautiful. Everyone, if a person is happy, he or she is beautiful. We can enhance the external beauty with the help of science, and everyone should take advantage of this. What can I say about Dr. Smita Chakote? She's full of positive energy. So whenever I meet her at some conference or some clinical meeting or anywhere, so what I see is a lot of positive energy, which she's trying to spread to all of us and her patients also. And I really thank her for calling me here today and interacting with me. Yeah.
Thank you so much, Dr. Trupti, because you are one of the pillars of Mission Beauty. Mission Beauty cannot be a mission of a single woman.
Yes.
It's a collaborative effort with the beautiful, wonderful, experienced dermatologists like you. So I would say you are one of the Kohinoors or the pillars of Mission Beauty, and so thankful to you that you spare your time through your busy practice and your family, and you have shared wonderful tips to all the women out there. So please watch this interview till the end, and don't forget to consult Dr. Trupti if you have any questions in regards to your hair loss. And we definitely will give you all the address and contact numbers. So feel free to meet Dr. Trupti when it comes to hair loss issues. Thank you so much, Dr. Trupti.
Thanks a lot. Thanks a lot, madam. Thank you. Good day.